is they do 70% of the work.
All right, I'm going to call the Kalamazoo County Board of Commission or Committee of the Whole, April 18th, 2023 to order. Clerk, would you please take roll?
Commissioner DeLu,
Here.
Commissioner Gisler,
Here.
Vice Chair Pro Tem Hepler, Commissioner Mazer,
Here.
Commissioner Morales is here, Vice Chair Ray, Commissioner Strebs,
Here.
Chair Taylor,
Here.
Commissioner Wheeler,
Here.
9 present.
All right, thank you. This next on the agenda is public comment. This is an opportunity for citizens to address the Board of Commissioners. Please give us your name and address, and you have 3 minutes.
My name is Kathy Cunningham. My address is 463 Ashery, Schoolcraft, Michigan. And I am here just to say that because of the YWCA's proposal, I would like to speak about that. And I think we all know that the founder of Planned Parenthood, Margaret Sanger, was an avowed racist and depopulationist. And I think that the money that the YWCA would like to use to support Planned Parenthood would be better used helping mothers raise our future citizens. And there are many people who would love to help as well. And the other thing that was apparently coming down the pike was what is called euphemistically affirmative gender care, when in reality, you could say that it is the mutilation of secondary sex characteristics. And we have a lot of detransitioners now who are suing the doctors who contributed to their physical mutilation. And I would rather see that money used for support and counsel for those of us who struggle with our sexuality, you might say. And I think that that's a problem that could face many people. The reality of male and female exists, but within ourselves, we have varying struggles. And I think that money could very well be used to support our fellow citizens. And with that, I will close. Thank you.
Thank you. Are there any other citizens wishing to address the board? Welcome our former county chair, Tracy Hall.
Chair Taylor, it's good to see you. Vice Chair Pro Tem, Commissioners, how are you all? I'll be quick. I'm here to, I still have bruises on me from when we had the YWCA on the agenda. Despite those bruises, I'm incredibly proud that we supported and passed funding to help support the Reproductive Health Fund. I did not know then that I would find myself in the role of Executive Director of Outfront Kalamazoo. For those that don't know, Outfront Kalamazoo is our LGBTQ community organization. We're an advocacy center and a resource center for all individuals. This topic was near and dear to me then, but seeing how many young people we have helped because of the gender affirming products that we carry at Outfront, you all would be amazed. The demand is so high that when my staff sent the YWCA an updated list of inventory items we need, you got to pare your list down because that's how high our demand is. So I'm asking you with your open heart and your open mind that I know most of you have, I'm sure all of you do, but there's only a few that I know very well. I know your hearts and minds to consider reallocating funding to the YWCA. It is life-saving, and I'm not being hyperbolic. And I'm happy to talk about, I know today's not the day, but if you want to talk about individuals who have since detransitioned, I'm happy to lift up the many, many, many trans individuals that I know that because of the products and the resources we have, their lives are much better. And if you want to know what kind of products we have, please stop by too, because there seems to be some confusion Things like binders, things like combs and brushes, makeup, gender affirming product, right? And there's no shame around that. In fact, I'm proud to say in my last term, I wore a binder every day and you all still love me. All right, thank you.
Thank you. Are there any other citizens wishing to address the board?
Hi, good afternoon. My name is Shravani Alluri. I live at 6518 North 28th Street, Richland. I'm a family physician here in Kalamazoo and co-chair of Cradle's Reproductive Health Subcommittee. And I'd like to make a statement today about YWCA's Reproductive Health Fund and supporting it as well. So the Reproductive Health Subcommittee supports and designs initiatives that increase access to reproductive health services and strives for reproductive justice in our community. We believe that access to comprehensive reproductive health services is an essential step to decreasing the disparities in Black, Brown, and white infant death in Kalamazoo. And when I say comprehensive reproductive health services, I don't just mean providing medical services like just pregnancy care or treatment for sexually transmitted infections like gonorrhea or HIV, or abortion care and gender affirming care. But actually, the comprehensive reproductive care includes all the things that an individual needs to achieve good reproductive health. So this includes access to food, access to housing, financial security, and feeling safe in one's own community. And we need to support people's basic needs to be able to achieve good health. And as a family physician, I take care of children and adults. I take care of pregnant individuals as well. And I see firsthand the difficulties that my patients have when they're trying to access essential reproductive services. We have so many health services in Kalamazoo, between all the services provided by the public health department, like free family planning and treatment and testing for sexually transmitted infections. We have all of our healthcare organizations like the Family Health Center, Borges, Bronson, WMed. But despite like this wealth of medical care in Kalamazoo, we still have so many patients that fall through the cracks. And one of my patients was a Black woman in her mid-30s. When I first met her, she was unhoused, living in kind of alternating between couch surfing, living in encampments, and in temporary shelters in Kalamazoo. She saw us initially to get an IUD placed because she didn't want to have children. And we finally got her into clinic after like 10 tries, tried to place the IUD, couldn't because of an anatomic issue. And with that, we tried to get her into a clinic that would get her other contraception, but couldn't get her into any of the free clinics just because of her social situation and the difficulties with transportation and getting her there. And one day, like she called us, just really worried, panicking because she just tested positive and was pregnant. She had just moved into a house. She was basically barely getting by. She was barely meeting her basic needs, not even getting 2 meals in a day with the finances that she had. So I actually got in touch with the Y and through the Reproductive Health Fund. She was considering abortion as a possibility for this. And they were able to, but she didn't have transportation. She didn't have the funds for it.
Sorry to just
Yeah.
wrap it up in the next
I
30
will.
seconds or so.
Yeah, she didn't have funds. Reproductive Health Fund helped her actually get what the care that she needed and make that choice. And like I had mentioned earlier, medical care isn't enough. We need to support the basic needs. And Y's taken a step here in doing that through the Reproductive Health Fund. But I think like this responsibility can't just lie on one organization or on grant and philanthropic funding. It's just not sustainable and limits the scope. And that's why we need investment from the county to actually broaden the scope of these services and support individuals and families in Kalamazoo. Sorry for running over.
No problem. Thank you very much. Are there any other citizens wishing to address the board?
Hello, can you hear me? Oh, Jenny Hill, 3106 Bobolink, Kalamazoo, Michigan. I'm also representing K College from the Student Health Center and as a nurse. So I just want to say I hats off to Tracy Hall and the doctor that just spoke, because that's the same line of thinking that the health center also goes with. I want to approach the equity and the equality of it. So what the Y is proposing, their funding would serve as equity that recognizes that each person has a different circumstance, and they all need, the Y would support and allocate money that would get them resources and an opportunity to get the same outcome as a person who provided equality. So I think that's very important. The inequity of it is affects marginalized people in communities such as women, disabled people, LGBTQ, economically disadvantaged, Black and brown people, and BIPOC people. So the Y would level that playing field by adding equity to it. So the goal of equity is to change the systemic and structural barriers that get in the way of those people accessing, like the doctor spoke of, accessing care. I know that they're looking at doula care. That was just passed by Medicaid, so that is going to start paying for doula care, and that's the women, or it's usually a woman that's a doula, supports the parent during pregnancy, after pregnancy, and during labor and delivery. So that's important. It also supports gender affirming care, which Tracy Hall spoke about, which is person with their gender identity, such as hormone therapy. And a little known fact, K College, over 40% of our students identify as non-binary. Thank you.
Thank you. Any other citizens wishing to address the board?
Good afternoon. My name is Dr. William Nettleton. For the last 6 years, I've served as the medical director for Kalamazoo County Health and Community Services Department. Here this afternoon to affirm the importance of NHANES, the National Health and Examination Survey, which will be rolling out shortly in our community. And we have a presentation this evening from Dr. Tony Nguyen. So in addition to my role serving as our local public health physician, I'm also a practicing family doctor. Just wanted to share 3 quick examples where NHANES really does impact my daily practice. So first, when I screen kids for pediatric lead levels, these data come from NHANES. That's how we started doing that, was with NHANES. When I measure the height and weight of babies, newborns, adults with our growth curves, those data come from NHANES. And when we had the PFAS incident several years ago, where water was contaminated with those chemicals called PFAS in Cooper Township and in Parchment, one of the first things I did was look up what's the background level in the national population for PFAS in our human population. That's where I went to first, was NHANES. So I just wanted to affirm the importance of participation in NHANES and the importance of hearing from what is going to be happening in our community in the coming weeks. Thank you.
Thank you. Any other citizens wishing to address the board? Sorry.
Good afternoon. Commissioner Keisha Dickerson, just wanted to say hello. Thank you all for your jobs that you do. They are very difficult, I know firsthand. And just saying, thanks for having me.
Thank you, Keisha. Any other citizens?
Hi, okay, we can hear me. Okay, hi, my name is Ellie Grossman. I work for Planned Parenthood of Michigan in the Kalamazoo office. I am a sexuality educator, so I work every day with college students, with students in Kalamazoo public schools and after school programs and with our community members. So I know their fears. I'm very familiar with what they do and what they need to know. We have really remarkable healthcare services in Kalamazoo, right? You've heard some of our doctors speak today. Planned Parenthood prides itself on providing healthcare. But what the YWCA Reproductive Health Fund does that is serving folks in a way that no one else is really serving folks is that it provides funding for things that we don't think about when we think of medical care. It provides funding for things like transportation to doctor's appointments. It provides funding for things like childcare if somebody needs somebody to watch their children when they go to doctor's appointments. So even if we have these amazing access to medical care, it doesn't really mean anything if folks can't make their appointments or they can't get there. And with so many laws happening right now with barriers to gender affirming care and for abortion access and other things, taking down even just one of those barriers is a super important and really impactful thing. So on behalf of Planned Parenthood of Michigan, we encourage you to re-up the funding for the YWCA Reproductive Justice Fund. Thank you so much.
Thank you. Any other citizens wishing to address the board? Administrator Catlin, would you advise on anybody either with voice recorded messages or in the queue?
Yes, Chair, we actually have both. So Dina, may you bring over folks that have their hands raised, please?
Could CM Lutz please unmute themselves?
Dina, is Village Manager Lutz on a phone or a computer?
I believe a computer. I've asked her to mute herself.
Are there multiple people in the queue?
She is the only one and she is unmuted, so she should be able to address the board now. I can proceed with the pre-recorded calls if you would like.
Yeah, let's do that.
Good afternoon. I'm Jeanette Rabinski calling from Kalamazoo County. Please play this message at the 4 p.m. meeting of the Kalamazoo County Board of Commissioners on April 18. I'm calling about item number 4 on your agenda, the presentation during which the YWCA is going to request money for their reproductive health fund. I oppose giving any money to that fund for 2 reasons. First, so many of the services which that fund provides are against the Catholic religion and other Christian religions. I find it ironic that YWCA stands for Young Women's Christian Association. I don't think Christ would promote killing babies in the womb or changing one's birth gender. God alone has the power to determine if a person is born and whether that person is born male or female. His decision should be accepted, respected, and honored. Secondly, if you want to end school shootings, then work to end abortion, not promote it. Abortion has a way of making people numb to the value of life. Abortion up to the point of birth is not that far removed from partial birth abortion and post-birth abortion. Those abortion victims are only a few years younger than those whose lives were terminated during preschool and elementary school shootings such as Sandy Hook and Covenant School in Nashville. Those in turn are not that far removed from high school and college shootings like Columbine, Uvalde, Texas, and Michigan State University. The culture of death has snowballed. It has permeated the womb, elementary schools, high schools and colleges, music venues and theaters, and churches, to name a few. Some people might say that some abortions are medically necessary. It's estimated that over 63 million babies in the womb have been aborted in the U.S. alone since it became legal in 1973. How many of those do you think were medically necessary? Just because abortion is legal doesn't make it right. We all know of things that were legal in the past but are now considered heinous, and rightly so. Please don't be a part of the culture of death. Instead, be the commission that leaves a legacy of life. please don't give any money to the YWCA Reproductive Health Fund. They have funding sources other than Kalamazoo County into which they can tap. Thank you.
My name is Keith Marotti, and I live in Texas Township, zip code 49009. I'm calling because I strongly oppose the abortion funding proposed by the YWCA. There are currently no restrictions on abortion in Michigan. Planned Parenthood already receives substantial financial support from the federal government, as do other agencies that perform and support abortions. I object to the additional use of my tax dollars to further support something that I find morally offensive. The destruction and mutilation of human life is not something that the Kalamazoo County should support in opposition to the moral beliefs of a significant number of its citizens. Every human life is precious and sacred. The dignity of every human life should be cherished and not viewed as a commodity to be mutilated and destroyed. And this is why I strongly oppose the funding proposed by YWCA. Thank you.
Hello, my name is Hope Marotti. I live in Kalamazoo. I would like to leave a comment about this proposed grant to the YWCA, which sounds like it's already receiving plenty of money from different places to snuff out young lives. So abortion is a big deal. I don't understand why the YWCA is so invested in it. And I'm reading from the story saying they got this money from someplace, and in the first year, it's focusing on expanding access to abortion care, but also decreasing the Black infant mortality rate. I'm sorry, how do we reconcile those two things? No, this is not something the county should be setting their feet into at this point. So I want to strongly go on the record as saying I oppose this. And the fact that they threw the doula thing in there was clearly just to deflect and say, oh, well, you can't vote against that because that's a good thing. Abortion is not a good thing. Allowing young children to mutilate their bodies before they even understand the significance of what they're doing is not a good thing. So I respectfully submit these comments. Thank you for considering them.
Good afternoon. My name is Ann Cooper, and my address is 2106 Helen Avenue in Portage, Michigan. I'm calling on Monday afternoon, April 17th at 3:35 p.m., and I'm leaving this public comment to be shared at the Board of Commissioners Committee of the Whole meeting, which is scheduled for Tuesday, April 18th, 2023 at 4 p.m. I am calling to voice my opposition to Kalamazoo County funding for the YWCA Kalamazoo Comprehensive Reproductive Health Fund, which is being reviewed at this meeting, agenda item number 4. I strongly oppose the use of taxpayer funds to pay for abortions under this YWCA program. I strongly oppose funding abortions with taxpayer money at any time. Abortion is the intentional killing of a preborn child and goes against the teachings of all Bible-based religions, including my Roman Catholic faith. Funding abortions with taxpayer money goes against the beliefs of all American citizens, as expressed in our Declaration of Independence, which states that we hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. We, as American citizens, therefore, believe and uphold that the right to life is a right which belongs to all human persons of any age, preborn or born. I do not support using taxpayer dollars to fund abortions performed under the YWCA Kalamazoo Comprehensive Reproductive Health Fund. Please terminate funding for this YWCA program as soon as possible. Thank you.
My name is John Burhans. I reside in Portage, Michigan. I'm calling in opposition for funding to be granted for YWCA to have abortions conducted. It should be followed by what the Supreme Supreme Court has decided that abortions should not take place. Additionally, I, as a Catholic, do not view that or feel that my tax dollars should go towards abortions. Therefore, I'm in strong opposition for this to be funded for abortions or any other funding which the YWCA chooses to make as far as gender, as we were born a boy or a girl or male or female for a reason, and that is as God wants us. There should not be any gender transition. Thank you.
All right. Do we have Village Manager Lutz on the line?
Yes, she is still online. She appears to be unmuted as well. I don't know if she's on a computer or if she's on a phone.
Well, I'll give her about 1 minute. Is that
Village Manager Lutz, if you're on a phone, you can press *6 to unmute yourself.
Well, I think we should move on. If Kevin, if seeing no other people on there, and we're having a hard time getting Village Manager Lutz, but if you want to just go into the next item, a National Health and Nutrition Examination Survey, presentation by Tony Knight.
Good afternoon, Commissioners. I'm Jim Rutherford, the Health Officer at the Health and Community Services Department. Dr. Nettleton and I are both very excited to introduce Dr. Tony Wynn, who is a pediatrician that's worked as an Army medical officer in private practice and at the local health department level. He's currently an active officer within the U.S. Public Health Service, beginning his career at the CDC as a member of the Epidemic Intelligence Service, EIS. After EIS, he transitioned to become the Chief Medical Officer of the National Health and Nutrition Examination Survey. As CMO, he provides the clinical oversight for all health examinations and serves as a primary medical point of contact for participants or medical providers regarding NHANES test results. As a CDC medical officer, he is also deployed for health threats such as Ebola and COVID-19. In addition, he has served as the Deputy Director of the Medical Services Branch on a U.S. Public Health Service Rapid Deployment Force team that could quickly deploy around the nation in the event of natural disasters or other urgent health needs. So we're just very, I think, fortunate to have NHANES pick us as one of the communities to come and examine and do their survey. They only pick 15 communities within the country. So from the public health perspective, we're kind of geeks about stuff like this. So I want to, without further ado, welcome Dr. Wynn.
Thank you, everyone, for having me. I think in respect for everybody's time, I know I have 10 minutes. So what I want to do is show you a quick 7-minute video, and that should give everybody a good understanding of what NHANES is, how we do it, and why we do it, as Mr. Rutherford just was alluding to. And I think that should leave some time for questions at the end.
The numbers are in, creating the most accurate picture ever of our nation's health. And one national survey plays a prominent role in improving the health of all people living in the United States. NHANES. NHANES, the National Health and Nutrition Examination Survey, is the only nationally representative survey that conducts home interviews and actual physical exams. The data from interviews and exams completed in your county, combined with that from other counties we visited, provides a current picture of the health and nutritional status of people living in the U.S. NHANES data help inform research and shape policy by identifying key trends in health and nutrition and shedding light on emerging health issues. NHANES started in 1960. We've traveled to hundreds of communities across the country and conducted examinations on more than 240,000 people. Since 1999, 15 counties are visited each year, where we examined approximately 5,000 people. NHANES field interviewers collect information about the health and eating habits from one or more people living in every sampled household in each county. Once interviews are complete, the selected household members schedule their physical exams. The exams happen here, inside state-of-the-art mobile examination centers. They're performed by teams of health professionals working with the National Center for Health Statistics, which is part of the Centers for Disease Control and Prevention. Each team of examiners includes a nurse, a phlebotomist, skilled laboratory and health technicians, and other health study professionals. The NHANES exam varies by age group and gender. It can include height and weight measurement, body composition, blood and urine collection, and a private health interview. The health and safety of NHANES participants is our highest priority. We follow all CDC guidelines for use of PPE, cleaning standards, and gatherings. Exam participants are performing an important service for their country, as well as taking action to monitor and improve their own health. At the end of each exam, we provide a token of appreciation for their time and effort in the form of a debit card. We also give them results they can share with their doctors. Data from NHANES serve an important role in monitoring the nation's health and are critical to the work of public health leaders and decision makers. Government agencies and private sector organizations use NHANES data to establish policies and plan the research, education, and health promotion programs that make a difference today and may help reduce health problems in the future. For example, in the late 1970s, after NHANES data revealed a disturbing number of Americans had high levels of lead in their blood, Congress introduced legislation to remove lead from gasoline and paint. Over the next 2 decades, NHANES data monitored the decline of lead in blood. NHANES provides national estimates on HPV infection in girls between the ages of 14 and 19. These data have helped to shape prevention policies for HPV, which can cause cervical cancer in women and other cancers in both men and women. And since the introduction of the HPV vaccine in 2006, NHANES data have shown a dramatic decline in infection with the HPV types targeted by the vaccine among 14 to 19-year-old girls. NHANES data have been used to identify the need for programs to reduce hypertension and high cholesterol, provide data for pediatric growth charts to track children's physical development, show the importance of fortified foods in helping to prevent birth defects, and inform recommendations for nutritional labeling. You may wonder why, out of over 3,000 counties across the country, yours was selected for the NHANES. Your county was selected randomly to represent other similar counties across the U.S. using a scientific process and information gathered by the U.S. Census Bureau. First, we divide all counties in the U.S. into 15 groups based on their characteristics. One county is selected from each group, and together they form the 15 counties NHANES visits that year. Then within each county, smaller groups, like neighborhoods or groups of blocks, each with a large number of households, are formed. Approximately 20 to 25 of these smaller groups are selected, and all houses and apartments within these areas are identified. Finally, an average of about 30 households are selected within each group and asked to participate in NHANES. Each household is asked general information about the persons living there. A computer algorithm then randomly selects household members to participate in NHANES. Each person examined in your county may represent as many as 65,000 or more similar people across the country. By joining in an effort as vital as NHANES, your county becomes part of something bigger, with meaningful, lasting impact. We are so pleased that your community will play a major role in the upcoming NHANES. Your assistance and support during the next few months will influence the health of the U.S. population for decades to come. Your participation is critical to our ability to advance knowledge that guides future research, policy, and education initiatives. We look forward to working with you on this important effort to improve our nation's health, one community at a time.
So I hope that provides a good background of what we're doing. I had shared more slides in another video that gives a more in-depth aspect of what it's like inside our mobile exam centers and some of the tests that we do. So if you do have more interest and you have time, please review that video. But for the rest of my time, I want to be able to open up the floor to see if there are any questions from the board.
I have one. How can we be of service as a county commission to this process? Obviously, elevating this to the public's mind so that they participate actively. But are there any ideas that you have of us or things that you have of us to make this process more successful?
Yeah, thank you for that question. I think the biggest thing is what you just said, just elevating to the public so that the county knows that we do exist. You know, it's one of those things where it's hard to believe sometimes that the federal government does, aside from the Census Bureau, sometimes go door to door, right? We have randomly selected homes where we will go to homes after sending them letters to let them know that their house has been or their home has been selected for the video. But to be able to just legitimize us, that we are a federal entity, that we do this, and we do it for the health and nutrition status of everybody living in the United States, and that their participation is really important. That statistically speaking, every participant actually represents 65,000 other people living, 65,000 other people just like them, right? So using me as an example, I represent 65,000 other 5'5" balding Asian men walking and running around the country, right? So their participation is really important. And so for folks that say, I'm really healthy, I have my own doctor, I don't need to participate, my response back is, well, we want to know, why are you healthy? Is it because you eat right? Is it because you get enough sleep? Is it because you exercise? Or is there something else going on? Same thing for somebody who may have a chronic illness. We want to be able to make sure that we're capturing all the health implications that comes with that chronic illness for that person, but also 65,000 other people just like them, right? So getting that assessment is really important to really understand the health of our nation. And for those that need the assistance, and whether it be medical transports, we can arrange for that. We arrange for transportation costs. So if you have to take public transportation or a Lyft or an Uber, we will reimburse that. For those that drive, we will reimburse that mileage for you. We do give some incentives, as you saw in the video. And in addition, for those that, for families that, you know, they may only be half of the family may be selected into our survey, we will provide childcare or elder care for families that may need it, so that they are able to more comfortably come to our mobile exam center and feel a little bit more comfortable and safe that their loved ones at home are doing well.
Vice Chair Hepler, Vice Chair Pro Tem Hepler.
Thank you, Chair. When is this planning to start?
So we have started already interviewing already, and we've thus far, Victor Barajas, my study manager here, and we've already, from what I understand, have received actually a really warm reception from the residents in the county, which is wonderful. So what we do is we start interviewing folks and asking some health questions beforehand, and we have an open house on May 1st, and our first real day of examinations will occur on May 4th. And our examination center is located at the Delta Hotels close to Western Michigan University.
Chair Ray.
Thank you. Thank you for the presentation. The randomly selected homes, are they in a specific neighborhood, or are they just throughout Kalamazoo County?
They are they're throughout the county. So it's all randomly selected within the county. And so we can show you the specific aspects. For major confidentiality reasons, we don't share it and share it publicly because of fear of others being we protect the identity of our participants very, very carefully. And so we don't want to publicly share certain aspects of where we're drawing from, just because there could be one person with one illness that only exists in that county or something, where we don't want somebody to look up that health data. So we go above and beyond for that. But we do have randomly selected what we call segments or communities throughout the county.
Well, thank you very much for what you're doing, and thank you for selecting us.
Thank you so much for your time. Appreciate it.
All right, next on the agenda, the YWC presentation on Demetrius.
Hello, everyone. Good evening. My name is Demetrius Wolverton. My pronouns are they, them. I serve as the interim chief of staff for YWCA Kalamazoo. I have been with YWCA for about 7.5 years. And before I jump into the presentation, I do have some remarks that I would like to lift up. It is with great excitement and urgency that I get to present to you all today. As we sit, our rights to access comprehensive reproductive health care services are being unjustifiably taken away. Even though we know that 3 out of 5 Americans support access to abortion care, we have studies that have shown that doula care during pregnancy and birth is proven effectively to improve labor and delivery experiences for Black and Brown birthing individuals, and that research demonstrates that gender-affirming care greatly improves the mental health and overall well-being of individuals who identify as LGBTQIA. Today, we have the opportunity to ensure that Kalamazoo County residents have the opportunity to live their full and authentic lives. YWCA Kalamazoo is asking the County Commission to support the allocation of $100,000 to the Comprehensive Reproductive Health Fund. The continued support of the county will further help to alleviate barriers and make comprehensive reproductive health care more accessible for Black, Indigenous, people of color, LGBTQIA individuals, and people working to make ends meet. In 2020, YWCA Kalamazoo came before the board recognizing a critical opportunity to bridge the gap that our residents face in accessing comprehensive reproductive care. With the county support and the support of our generous partners, we can confidently say YWCA Kalamazoo houses the only comprehensive reproductive health fund in the country. Since the launch of the Reproductive Health Fund, YWCA Kalamazoo has been able to quantify the need that we already knew existed here in Kalamazoo County when it comes to accessing reproductive health care. However, before I talk about that, I want to acknowledge that other counties are still facing hardships when trying to access care. In 2021, a U of M research team calculated that on average, most Michiganders face a 2-hour round trip for accessing abortion care. In addition, as it relates to other services, one third of adults in our state do not have enough in their savings to pay for a $400 emergency. This means that Michiganders and Kalamazoo County residents are choosing to forego essential healthcare services because they do not have the means to afford it. Our Reproductive Health Fund addresses these barriers, no matter how close or how far, or no matter the cost. Although the fight for reproductive justice is much bigger than Kalamazoo County, and thankfully there are localities doing this work, I want to speak briefly about how our fund is unique in all of the services that we offer. YWCA Kalamazoo's Comprehensive Reproductive Health Fund is a fund that works to zero out the balance for abortion care, prenatal and postpartum doula care, as well as services to gender-affirming care, which includes services such as identity markers and changers to your birth certificates, driver's license, and the access to post-exposure prophylaxis, which significantly reduces the transmission of HIV. In addition, puberty blockers. Gender-affirming care also includes products like shot kits, gender-inclusive swim and menstrual wear, and access to hormone replacement therapy. Our fund provides practical support to access these services, such as travel, lodging, and even childcare. We also would like to take this time to recognize our reproductive health fund partners, Planned Parenthood, Optimed, and Rooted Red Birth Green doula services. I would now like to turn your attention to the presentation that has been put together for you all today. If we can go to the next slide, it just simply speaks about the values of the Reproductive Health Fund. Our goal is to make sure that individuals have economic security and are able to live their full and authentic lives. People should not be choosing between daily essentials and health care. If we can go to the next slide, please. I would like to lift up some data from 2022. This is our fiscal year that YWCA Kalamazoo runs on, which is January 1 to December 31st. 220 plus county residents were served through the Reproductive Health Fund. I would like to turn your attention to the number that says 247 is the number of times that the Reproductive Health Fund was utilized. That means that someone came to the Reproductive Health Fund in need of more than one service. It is important for us to be comprehensive and provide wraparound care. 50% of the users were people of color. In addition to that, I want to also do a lot of information correcting around who's accessing services. 40% of our clients were employed, which means majority of the individuals utilizing our health fund have health insurance that is not covering this essential care. In addition, 62% of our clients have an annual income less than $24,000. Next slide, please. The last piece of data I would like to present to you is the overall use of the fund. I know there is a lot of concern around what the fund is being used for, but also want you to know that abortion services is not the #1 service that the fund is being used for. The #1 service that is being provided through the Reproductive Health Fund is gender affirming care. That means that we are making a very inclusive and better community for individuals to come up and live their full and authentic selves. Yes, abortion care is the #2 service because it's important. Abortion, no matter what your beliefs are, whether it's political beliefs or religious beliefs, I think that everyone can agree that it is your right to choose when to parent and not to parent. Doula services is #3 along with other services, and those other services are services for transportation, emergency contraception, and lodging. At this time, you can go to the next slide. This completes my presentation to the Kalamazoo County Board of Commissioners. I welcome any questions you may have.
Questions from commissioners? Well, thank you very much for the presentation, Demetrius. And we will, in the budget cycle, I think is when we'll be discussing that. So not at this meeting, but.
Thank you so much.
Thank you. Next on the agenda is review of accounts payable and payroll disbursements. Kevin.
Thank you, Chair, Vice Chairs, Commissioners, audience. Tonight, we have an accounts payable claims list totaling $8,713,508.39. Of this total, the board is asked to approve a claims list totaling $8,619,235.92. Payroll disbursements totaling $2,273,118.29 are presented for the April 14th payroll. Happy to take any questions.
Questions from commissioners? Thank you very much. Next, business priorities. This is the first one. I'm having a hard time getting on the internet, connecting to the internet right now, but I will try to do this as much as I can by memory. But we have in our packets a economic development and property tax revenue sharing. The reason I pushed this policy forward is a number of years ago, this was maybe 7 or 8 years ago, the county commission got involved with, well, there were TIF policies created from a lot of the and corridor improvement authorities that were created from a lot of the different local municipalities. And the thought was the county had really no oversight and all these different TIF districts getting created that, you know, really drained the opportunity for revenue for the county in the future in a lot of these areas. My belief, and this is, I'm just one commissioner, is that we might have gone a little bit too far, specifically with the cap on those, on that policy where we cap it at a certain dollar amount. And I'm going to get it wrong if I try to do it out of heart, but I don't have my internet. But I was kind of proposing, and Commissioner DeLue had talked to me a little bit about this from Oshtemo. It had some concerns on the West Main, the corridor improvement. If we could look with maybe Rachel Grover and commissioners that were interested on looking at this TIF policy and talking with some of the local municipalities as well, the townships that utilize this. I think Kalamazoo Township is another one that's looking down the road at some of these corridor improvement authorities. But if we could have commissioners that are interested in this topic, I don't think it needs to be an official subcommittee or anything like that where we have to, correct me if I'm wrong, but if it's just a couple of commissioners discussing it, does it need to be a formal committee? Angelina?
Thank you, Chair. This question was raised actually throughout, I believe, this week or perhaps last week as well to me. And the feedback I gave on that is there are some concerns about, making sure that the board's policy work is done in the public view. And so to the extent that the work is going to be on important policies like this, the recommendation was that it be done by a committee versus meetings outside of a public meeting.
Well, first off, are there any commissioners interested in serving on this? It should probably only take, my guess is about 2 meetings, one with initially with staff, and then probably the second meeting would be representatives from the economic development teams and some of the townships or smaller cities that would like to participate in this as well. But Commissioner Strebs, Commissioner Hepler, Dale, and Tammy. All right, we got 4 commissioners. Great. I will work with administration and Rachel and try to set up some times for commissioners to meet. I envision this will probably only take 2 meetings. The first one internally with internal staff and our planning, and then the second one with some of the stakeholders that would be participating in a possible TIF or corridor improvement district. Is that acceptable to everybody? All right, now Commissioner Strebs.
Thank you, Chair. I just have one question for administration. In review of the current policy, that TIF limit at 2 mills or $1 million. It also talks about how advanced sort of coordination should occur with the municipal body and the county. And I just want to reach out and ask if administration has been approached recently for any potential TIF considerations.
I would need to defer to our planning director. I believe she's here tonight. Just give us a moment.
Not at this current time, Commissioner Strebs. There are 2 that were thought or for consideration in the past, but when that policy changed, I think they changed the plans and then the pandemic came up. So it hasn't been brought to my attention yet, but I know there were 2 plans from 2 different townships before.
And I have received I've been talking to Oshtemo Township about this as well. So they have expressed interest. Any other commissioners? Okay, we can move right along. Next, Commissioner travel policy. I hate to do this to you, Kevin. Do you want me to take the lead and you can take over? Well, we talked a little bit about it last time, what our needs for commissioners are to attend these conferences. Different numbers were kind of tossed around, but I'd like to hear it from you. My only need for travel and training this year is I'd really like to attend the one in Lansing next week. I think I'm already signed up for it actually. But that's the MAC, Michigan Association of Conference in Lansing. And then the one that's in Kalamazoo, but that should just be the cost of registration, the MAC conference. But are there, I guess, commissioners that have, things that they want to do in the future, they know that's coming up this year that needs to be a part of that? We've come up with numbers anywhere from, $1,500 a commissioner to, I heard up to $5,000 a commissioner. We've got strategic reserve fund that's in our, it's not under Board of Commissioners, I guess, but it's in our planning fund. That's a potential revenue source that we can use. And we also have, we've put $45,000 every year or the last couple of years for, to pay the $25 fees to people that participate in our advisory councils. We traditionally use about 6,000. Last year, at least, we used 6,000 of that $45,000 fund. This year, it's going to look close to the same. We'll use about $6,000 of that $45,000 budgeted. So that's a potential revenue source that we could utilize. But I would hate to run this completely by myself. So please, commissioners, give me some input. Commissioner Vice Chair Ray.
As far as things that, excuse me, I like to attend, there is an association called the National Association of Black County Officials. I would like to become a member and then also attend the national convention in May, I believe it is. I'm also signed up for this MAC conference, but if money's an issue, I don't mind not going because there's not a whole lot of interest for me there. I just thought we'd all be going because it's in Lansing. But that's it for me.
I think the MAC one's relatively inexpensive, right? Or it's like $400 or $500. Please, we've got the money in strategic reserve if commissioners want to attend some leadership, but training or MAC, Michigan Association of Conference training, I highly recommend that. I think that's well worth the dollars spent. But if you've got, an idea for policy, because I think it is really unfair to come up with a number of like $10,000 or whatever for the full Board of Commissioners and we'll leave it up to Kevin to try to pick and choose. I don't think that's fair to him. So if we could come up with a number that each commissioner could be responsible for, I think that would make sense. I'm not going to utilize, I guarantee all my number. I'm happy if anybody else wants to go to an event, they can utilize mine, but I just want to go to the Lansing one. That's it. Commissioner Straps.
Thank you, Chair. I'll chime in. I mean, we talked in our previous discussion, a number of around $5,000. I don't think the majority of commissioners will utilize that amount. And I would expect when a commissioner comes close to it, that wouldn't be on an annual basis. So that's what I would propose so that we can be efficient. There's a time frame to register for conferences in a timely way so that they're more cost effective. So it just allows us a little bit of flexibility to accomplish those things. But I potentially am interested in a national NACO conference, I believe is in August in Texas. I'm not sure if I'll actually be available to attend, but I would like it if I could. But I'd also like this board to consider some additional DEI trainings and conferences. I know E-Race has not hosted a conference in some time that I'm aware of, but it's a commitment a number of commissioners on this body have made, and I'd like to see all of us think about taking some of our training dollars and investing in some of that sort of cultural competency training and skill development. Potentially also internally from administration and our DEI department support, but also through community organizations as well. Thank you.
Any other commissioners? Well, we're still kind of where we started as far as what I was trying to do today was make it so that, you know, we're not all have a certain X dollar amount, whether I think we originally started with $6,000 or $5,000 for the full board of commissioners. We've gone through that, but that's far too low a number for the full board. But I do believe that it shouldn't be up to Kevin to pick and choose who goes. So I think each commissioner having a set dollar amount, is that kind of where commissioners are going with that? Do we have a dollar amount that we think is appropriate? And Kevin, I'm sorry, I can't get into my internet to see if there was something in the civic clerk with a proposal from you guys.
Yes, Chair. So what we included in the packet was just a couple of policy revisions. I know that commissioners wanted to entertain travel advances. And so there was actually a policy where that explicitly stated that commissioners were not able to receive travel advances. So we are obviously striking that language, proposing that it just be stricken from the policy. And then we've also included under the business expense reimbursement policy that the board chair and the county administrator must approve board of commissioner travel requests, just to ensure that obviously commissioners requests align with the proposed or with a proposed budget per commissioner. And it's obviously it requires your signature as chair because you all are my supervisor. So it's quite awkward for me to sign off on on that travel, but I'm signing for the financial aspect essentially. So just to ensure that the funding's there. And then lastly, under business expense, we just have the mileage, some mileage reimbursement language that we proposed from traveling from home to a site, an event versus traveling from the workplace, which would be here to an event. So we just cleaned up some language there. And then lastly, in the financial policies, we just stipulated that obviously reimbursements need to align with the business expense reimbursement policy. So just all of that's just cleaned up, but that's all we had in the packet. And then obviously we're just looking for feedback on the amount that the board wanted to entertain for an allotment per commissioner. I know that we last meeting we spoke about $3,000 to $5,000, so somewhere in between there or one of those numbers.
Thank you. Is there any idea as far as the number that commissioners think is appropriate? I don't want to make this number up out of my hat. I mean, I guess I could go through and look at all what the commissioners' averages are and then average them out and come out with an average. But, there are departments that do not, Board of Commissioners, I do think that, we don't spend as much money on office supplies or paper or that sort of stuff, but we should be spending more money on board development than other departments. But I will say there's a lot of other departments that have needs for training that do not have the budget that we have. So I think we need to keep that mindful as well. Commissioner Hepler.
Thank you, Chair. I don't want to go overboard, but my thought would be, no more than 3,000 per board member. And then if somebody doesn't want to use it, you can work it out with somebody. I think that's quite generous. As you indicated, there's a number of boards that already don't have that kind of resource. And I actually was leaning more toward 25 myself, but I'd go to 3, I guess, and just say, hey, for that many, and then we'll work it out as to so that our administrator doesn't have to pick and choose. I don't think that should be up to him. That should be our problem.
So I've heard my first number bantered about of $3,000 per commissioner with Commissioner Morales.
Thank you, Chair. Just with rising costs and, when we say 3,000, for me, it's low. I travel, and if we're talking about conferences being held in big cities, and hotels could be $250 a night. So I'm thinking between 5 and 6. I would settle for 5.
So now we have 2 numbers, 5 and a 3. Well, I think that if we do something to the similar where commissioners have, if you go over your amount and it's a decent conference, and as long as it's not like a magic show in Las Vegas or something like that, I'd be happy to sign the thing. But I think nobody on this board is going to do that. I think that everybody on this board has the seriousness that they're not going to sign up for a crazy conference. But Commissioner Gissler.
Thank you, Chair. I like the idea of having a per commissioner guide, but I'd rather, I think, see that number, whatever it is, applied to individuals by bringing it either to you directly and let you help guide how the money gets spent, or that we bring it up here, as long as we don't start beating a dead horse. It should be pretty easy if Montes is headed for a meeting that's in San Francisco. Well, that's kind of a haul, and the hotels are not cheap. But if it makes sense for her, I wouldn't have any trouble seeing her get a bigger portion of whatever that total allocation for all of us is. And I would hope we could deal with it fairly expeditiously and not turn it into, reinventing the wheel every time somebody wants to go to Chicago.
How about this, Administrator, if this is kind of what you're looking for? Commissioner DeLu, I'm sorry, you had your hand up.
Well, I was just going to rely on you experienced commissioners to, you've done this in the past. I don't know how much is enough, but I was thinking if you do 4,000 per commissioner, it's 36,000. The strategic fund you say we have left over every year would certainly cover that. No, 5,000 a commissioner it wouldn't, but 4,000 it would. And that'd be a good place to take the money from, since they don't use it any.
Yeah, I think they were using that fund at one point for like Leadership Kalamazoo, I believe, or some of the stuff that they didn't do last year, haven't done before, but we do have it to get 36 from the Strategic Issues Fund is not going to be a problem. How about this, Commissioner and Administrator? What if we put for the whole board, because I'm only going to use about $1,000 of it for my two conferences, but we put the whole thing of it 36,000 for 4 per commissioner. And if it goes over 36, then it has to get signed off by the administrator and myself. If we go over 36, and we'll have a discussion. Does that sound appropriate to everybody? Because we'll never get to, I don't think we'll ever get to 36 as a board. Tammy.
Thank you, Chair. So I don't have an issue with that method, but I don't know if Commissioner Gissler will, I don't want to come back and have a discussion in 3 months because he feels he hasn't used anything, and Commissioner Streds or Commissioner Morales has went on to 2 conferences and then there's an issue. So as long as Commissioner Gissler is not gonna be petty and be watching people's travel, then I could support that.
And I think we as a board have moved and developed quite a bit in the last 3-4 months. I know Commissioner Gissler will not be doing that. I have faith. Now, he may want to go on a trip to Augusta or Pebble Beach, but I don't think he's going to put in for it.
You haven't seen my golf game recently. It's really bad. I'm thinking of bowling.
Okay, that's cheaper. Commissioner Morales.
Thank you, Chair. So how much was, DeLu, how much did you say, how much was in that? I know you said 4, but if we do, but if we take it up 1,000, where could that, we don't have enough money to cushion that? Because if I do go to San Francisco or to a conference in Miami, I don't want to come back and somebody feels like I shouldn't be at that conference, or I've soaked up enough of my money. I don't think we're going to abuse this. I think 5,000 is safe, even if we dip into that other account, just across the board. If you're only using 2, we know we may have a little cushion with yours, but I just don't want to come back and forth if I want to go somewhere and it may be 3 different times, but something was, if I go to MAC, it's 500, but if I go to another one is 1,500. I just don't want to come back for the debate. I want to go to where I feel I need, more education and I can be a more effective commissioner.
And I will commit to every commissioner, not just you, Commissioner Morales, but every commissioner here, as if it's a training to help and betterment on your board, I will support it 100%. And if we get over at 36,000, I'm happy to sign that, as long as as long as it's not to go golfing in Augusta or something like that. Okay, I think you have enough direction on that, Administrator? We could probably chat afterwards, but I think I've got a pretty good idea of where people are. I don't think we'll ever go over 36 as a board. I think most commissioners are going to be using like $1,000 or less, but. Okay, next on the agenda, Justice Center update, Jerry.
Sorry, can you hear me now? Well, good afternoon, everybody. I see a lot of faces here that I know, and I see some new faces. So for those of you that don't know me, I'm Jerry Vanderveen, and I've been the owner's rep on the Justice Center since 2017, if you can believe that. But I thought it would be appropriate that I give you a kind of a face-to-face update. So if you'll bear with me a minute. First of all, just want to let you know that to date, this is through last Thursday, we have spent $66,931,165 on the Justice Center on an overall budget that has not changed of $94,343,712. So we're getting there. In terms of budget, I think we're in really good shape on this project. We have approximately $4.5 million worth of contingency left. That is split between the contingency that the contractor is carrying of about $1.8 million and what we call the owner's contingency of about $2.7 million. So financially, I think we're in really, really good shape. From a progress standpoint, it's our intention, and I feel pretty confident about this, that we're going to be substantially complete over there about the 1st of September. We're going to be using early September as kind of a training and transition time for the courts and for the prosecutor's office, and then the move-in will occur shortly thereafter. So those plans are in the works. And I think, at least from my perspective, they've been proceeding quite nicely. So in terms of progress on the building, I think you all walk by it probably if you park in that surface lot. We are just about completed with drywall in the building. We're working on finishing in the lower levels and kind of working up. We're getting deliveries of millwork. We're painting. We're doing tile. We just about have every trade that you can have working on a construction job on that project right now. Kind of our daily head count over there is between 140 and 150 tradesmen. So a lot of activity. Also, a lot of trades now are working Saturdays. We have the big push on to get this project completed. I think the next big push or thing that you're going to notice is a big site work push. We've just started working on the ramp that goes down to the parking and Sally Port and holding area in the lower level, and that site work will continue and work around to the front of the building. So I don't want to take a lot of your time, but just wanted to come here and give you that update face to face and answer any questions that you may have. So thank you.
Thank you. Commissioners with questions. Commissioner Gissler.
Thank you, Chair. Jerry, we didn't know that we were going to be blessed with an additional courtroom and an additional judge when this started. And I know that had to chew into some of the contingency funds. Is your number saying we got $4+ million still left in contingencies? Cover that?
Yeah, Commissioner Gissler, that number moves around a little bit. It kind of gets chewed up as you go through the project. And I don't want to get ahead of myself and say that we're going to have contingency dollars left, but if, from my past experience, it would appear that we are. So as far as the additional courtroom, obviously that our current building project over there does not take into account the additional courtroom, but we have come up with a scheme, couple schemes that to accommodate the courts in that regard.
Thank you. Can you indulge me one more question? And this is
Please
super
do.
important. Have the doors for the courtroom, this is plural, arrived?
We have them.
I'm a happy camper. Thank you.
Good deal. And I think Administrator Catlin will probably be discussing that additional courtroom at another meeting. So, and that'll probably more than likely not be in that facility across this next door. But any other commissioner comments? Well, thank you very much. I guess just Kevin, we're gonna just do one more, like a 1 month extension with the MAC then to get people up to date with the software, and they're good with that. Plaza Core is good with that.
Yes, we have to work that out with them, but we'll get those details and have that in front of the board likely as well.
Thank you.
All right, well, thank you very much. Appreciate your time.
All right, next on the agenda, business priorities. Employees, Kevin.
Yes, thank you, Chair. So tonight, this item is on the agenda. We have it kind of rotating with the other business priorities. I know that commissioners had asked for an update on the employee concerns regarding the Siegel study. So we had provided information via email on that, and we're happy to take questions on those memos that were sent to the board. We're sort of standing by with policy revisions to be proposed. We've already drafted those and hope to get those in front of the board so that we can start aligning policy with the new classification system. However, we wanted to take time to ensure that the board is ready to move forward with those as proposed, and obviously those would be shared at a later meeting. Some of the concerns related to wage competitiveness could be addressed and even within current policy. However, we still propose that if there are issues of the sort, that those be reported to human resources and or administration so that we can address those. To date, we have not received any official requests on those topics, so we can address them if we don't have any official record of receiving that, but we're standing by for those. And again, happy to take any questions if there are any this evening.
Commissioner Stubbs.
Thank you, Chair. Thank you, Administrator Catlin. Can you please clarify the point that you just lifted up? So what does an employee or department head need to do to present you with a formal request?
Thank you, Commissioner Streb. So commissioners, to present a formal request, they just need to make contact with the HR director and explain the situation with regard to a specific position. So if there's a specific position within their department that has been quite difficult to fill, they can try to work out a solution with the HR director and administration to sort of provision a specific position market study to be conducted that might come back with results to, possibly increase salary to make it more competitive if it isn't already.
Thank you, Chair. So to clarify, Administrator, that is not for currently employed positions, but the policy you're elevating is a position that's become difficult to fill, maybe due to the wage competitiveness. Correct.
Yes, that's correct.
Vice Chair Ray.
Thank you. I just have a follow-up question to that. So we just got the study done. Why would there be a position that's not where it should be if this study is accurate?
So the study actually, so the demographics and the data that the study gathered were from 2021. So remember, the study was actually implemented this year. So Typically with studies, generally, they're already outdated by the time you implement them. However, we're not saying, administration and HR are not saying that that the positions are not competitive. We've heard departments come to meetings indicating that they're not competitive or that they're having difficulties filling them. However, we haven't received any sort of formal requests to study those positions. And so there's an avenue and there's an option within policy to address that. Department heads, elected officials, court administrators just need to follow policy and address them that way. But we haven't received anything to date. And we are not saying, administration and HR are not saying that positions are not competitive.
Just one follow-up question. So if a department head file a complaint and they feel like it's not competitive, who will then complete the position study?
Yes, so our current, so with the new classification system, which is Siegel, it would go through the HR department. So they have what's called a Siegel evaluator. It's a proprietary system that was put in place when we adopted Siegel. And so it would go through that system of a series of questions and all sorts of formalities that would then produce the new results, if any, about a specific position. So it goes through what's called the Siegel evaluator.
So there will be no additional cost to the county?
I would need to get back to you on that. I know from the last system that we used, which was Hay, there was a cost. So I don't know. I'll get back to you on that.
Commissioner Morales.
Thank you, Chair. To that point, when we do these market studies, do we take into consideration fringe benefits as well and compare it to other places? I know sometimes, we can set a salary at 75 or 80 and have immaculate insurance, and another institution may set it at, 100,000, but their insurance doesn't even compete to what other entities offer. So is that something or co-pays, sometimes you have higher co-pays or you max out quicker. So is that something that's taken into consideration when we look at our market studies for jobs right now that deem to be unfillable due to the salaries that we're offering?
Yes, Commissioner Morales. So the study in general, when it was conducted, it did evaluate a total compensation package, including all the benefits. And so that is still taken into consideration when even conducting a specific position. It's all rolled back in there.
I had one question, and I apologize if you've already sent it to me. But the 200, in the memo that you sent with the 272 employees, do we have a breakdown by department of those 272?
I can get that for you in short order. I did not send that out, but I can get that to the board. Absolutely.
Okay, thank you. Any other commissioner questions? All right, thank you very much. Then we are moving right along. Business priorities, mental health, substance abuse. Kevin, you're up again, or Lindy is up.
Good evening, commissioners. I believe my update this evening will be pretty quick, but just want to give you an update of where we are with the opioid settlement. Since we last spoke since I last spoke on March 21st, we have now signed the agreements for the 4 pharmacies. So in total, we have 7 settlement agreements that have been signed, and we have about 4 that we are expecting to still be forthcoming. As far as the status of the payments, we have still only received for the distributor in Janssen, which is $1,281,851.77. As it's outlined in the packet this evening, the settlements that we have not received, Myers, we're anticipating that to be 1 payment. And then the other 4 for the pharmacies, since that agreement was just signed, we know the payments over how many years, but we do not know the release of that first payment. So that is forthcoming. As far as the planning process, like I spoke about last time, so we have signed up through the Michigan Association of Counties to have a technical advisor for the opioid settlement funds planning and capacity building for a community needs assessment. Since then, we have been notified that we are starting that process. I did just have a meeting yesterday afternoon, so my notes are still forthcoming a little bit on that. But we will be working with the Opioid Prevention Education Network with Michigan State University. From that meeting, it was just an initial meeting that just myself had with Open MSU. And then what I will be doing is actually following up with Commissioner Stubbs and any other commissioners, of course, that would like to have that conversation, as well as the internal work group that we've been having discussions with our county officials. There's a lot of questions regarding from the community members, which I think are very warranted of, where are we in this process and how do we get involved, which is exciting to see that. But basically where we have decided to start right now is to look at that community needs assessment, wait for MAC to release additional information regarding their metric tools and evaluation tools. And where I guess I would like to say for the community partners and for commissioners this evening is once we start that community needs assessment, we really need to form kind of, who's going to be that core committee that's going to be leading that for the county. From there, we will start the planning process of that, which does then include reaching out to networks and coalitions, garnering input from them through surveys, focus groups, and then interviews. And then from there, coming back, all of that information coming back to the core committee, analyzing those results, and then having the reporting and the conclusion. So we are definitely factoring in how do networks and coalitions get involved. We just are at the very, very beginning phase of that still, but that is definitely a piece of the plan that is going to be included. The next thing I just want to make sure and lift up this evening is that I will be in attendance of the Kalamazoo County Opioid Coalition meeting that is held or will be held on May 4th from 11 a.m. to 12:30 at the Health and Community Services Department in room 361. That information is in the packet. This will be my first time attending that meeting and very much looking forward to what the Opioid Coalition has been doing in the community, giving them somewhat of a similar report that I'm giving right now, and taking in any information that I can to bring back to the commissioners or through Open MSU, who we're working with for that technical assistance for the community assessment. Struggling a little bit with my words there. I guess at that point in time, that's the main update I have. Does anyone have any questions?
Really quick, are there in any of these litigations or settlements that we're getting, are there any time limits as far as when funds need to be utilized? Is that?
Not to my knowledge as of right now. But I think all the settlement agreements, most of them have been somewhat aligned. I haven't been able to review the recent ones just yet that have been signed, but to my knowledge, no, none of them have a timeline of you need to start using this money or spending this money by this date.
And interest, I'm assuming, of these funds while we're holding it and coming up with our plan is just going to make that pile even ever larger, correct? Okay, well, it sounds like it's better to do it right than to rush it in if we don't have any sort of time constraints on it. I'd like to make sure that we move expeditiously on that. Commissioner Gissler.
Thank you, Chair. Excuse me, Lindy. Not only am I having the same trouble you're having, Chair, with civic clerk, but my hearing aids are deciding to play games. So I apologize if for any of those reasons I am asking you to repeat something you've already said. I would like to know if there's an estimate, and I think the last time we got an estimate, it was from the chair of, what the total of these settlements was going to look like. Has that changed at all? What are you looking at, do you think, if you had to guess?
We can look that up and get that information to you.
You
And
don't
then I
wanna make a
can also, I can also include that in the next report that I give to the
Okay,
board as
and
well.
would you also comment, maybe you need to do the same thing with, what are the limitations on spending? I thought I remember something when we signed on for that class action suit that the expectation was that there would be guidance, if nothing else, provided as to how that money could be spent. It's not going to be, we aren't going to be able to throw it into housing or ARPA funds or something like that, right?
So there are limitations or at least guidelines to how to spend the money. Again, I have only really in depth read the distributor and Janssen settlements. So I'm speaking towards that. Both of those have 85%. I think one is technically 84.5%, but we're just going to say 85% need to be used for opioid remediation. 15% is the unrestricted. For that 15%, we do have to report on a biannual basis of how we've utilized that funding. It's also strongly encouraged that we, make it very transparent of how we're utilizing the fund, all the funding to the public through an annual report and also on our website. But those two specific settlement agreements that I'm more familiar with, I haven't dove into the other ones quite so much, but there are limitations, keeping in mind that 85-15 primarily.
Thank you, Lindy. Thank you, Chair.
Yeah, and each settlement has its own limitations and its own restrictions to it, but that rule of thumb is that 85-15, 10 to 15% administrative costs. So it makes Angelina's life lots of fun, I'm sure. Any other questions from commissioners? Thank you very much. Next up, we have the Kalamazoo County Road Commission discussion. I'll let you lead it off, Kevin, and then I'll jump in.
All right, thank you, Chair, Vice Chairs, Commissioners, audience. So this evening, what I wanted to do was provide the board with basically a status update on the research that we've conducted regarding the directive for us to research cost for a study to be conducted, reviewing what it might, what efficiencies we might realize if the road commission were absorbed as a county department. And so per our purchasing policy, if there's any amount that's over $5,000 but under $29,999, we have to receive 3 quotes. I've only been able to get 2 to date. I'm still working on sourcing another CPA firm that could provide such an analysis. However, the 2 studies or the 2 proposals that I've received to date, one came back at $17,000, and then the other one came back with a range of $18,000 to $22,000. So I would expect that the 3rd quote that I will, or the proposal that I would receive, would likely be in the range of $17,000 to $25,000. I don't know what it would be yet, but we could probably expect something like that based on the scope of work that we presented to them. And it was essentially the scope entails them looking at efficiencies that would be realized by eliminating another layer of government, bring them in as a county department. So, you combine your financial systems, your HR management, those sorts of things. And so that's what I have to present this evening. I'm working on sourcing another CPA firm to obtain a price so I can have that final 3rd number to the board.
And the reason this is in front of us, I mean, we can't spend it without talking to commissioners, but I want to get a sense of where this board is at on this. My opinion, and I've shared it with Commissioner Strebs, the infrastructure is going to be difficult for us to take that over. But again, I am one member of this Board of Commissioners. So Commissioner Morales.
Thank you, Chair. I mean, most of you know that I'm highly opposed to market studies because they never favor the people that they need to favor. And for me, if we can come up with $25,000, then we can put it towards employee salaries. That's where I'm at. Now, as far as if we really need the study, I'm cool with that. But to take over another entity that I don't believe we really push dollars into, to take that over, I don't know anything about infrastructure, engineering, or any of that. So I would really need to know what that load looks like if we took over that. Obviously, it would affect the appointed commissioners who are currently working in those roles right now. So I need to know the commitment, what it looks like for other counties who have taken over that responsibility. Is it working for them? And is it really necessary? Or are there some things that we can hash out with the road commission and learning more about what they do and what they're responsible for? And then it puts me in another situation that I think we need to have a discussion on what our oversight really means. If we can't provide input to commissions because we don't give them money, or, you know, and they're just here for the appointment and we have nothing else to do with it, then why are we doing it? I believe that they can do that on their own and have their own committees to appoint. I think we're appointed to so much right now, and then we get in there and we're being asked to be excused from meetings. We get inflammatory emails on what our job is, what we do and what we don't do. And quite frankly, I'm sick of it. So I think we need to make a decision on what the board is going to commit to and let folks and other entities figure out their own problems, because we have a whole bunch of fish that we have to continue to fry. Thank you.
Commissioner Gissler.
Excuse me. Thank you, Chair. I have a letter that was signed, not signed, there's no signatures on it, but it was issued with the proviso that it was going to probably be in my hands and read into the record at some point from the 15 township supervisors who are the main recipients of the road work that goes on. And if I could, it's a full page and I can make, copies and have it distributed. But the essence of it is that doing something about how the road commission is, the road commissioners are appointed, elected, brought inside as a department. It's a solution in search of a problem. We have among the best roads in the state, and these 15 people who are the main ones that would know if there's anything wrong with the way the road commission's operating are unanimous in saying, let's not meddle with this. And they also indicated that whatever the cost of a consultancy is, they don't want to see any county money spent for that sort of thing, whether it's 5,000 or 50,000. So thank you.
Thank you. And I will, to defense of the road commission, they are at a Michigan Township or Michigan Road Commission conference in Traverse City. So that's why they're not in attendance other than Keisha. Thank you for being here, Keisha. Commissioner Krebs.
Thank you, Chair. So the assertion that there's a unanimous agreement among the supervisors of the township, I don't think is an accurate one. I directly reached out to each of them. There was a supervisors meeting that happens monthly. The road commission was able to articulate a viewpoint, wishing to continue the structure as it is, which is valid for them to advocate for. But there's not been a dialogue engaged about what other concerns are present. And so I reached out to each of the township supervisors. I was not able to connect with all of them. I connected with Jeff Sorensen recently at EHAC, and I've been invited to come and speak at a supervisors meeting to articulate through the concerns that have led to the dialogue that we're engaged in. But additionally, Oshtemo Township, Alamo Township, and even Prairie Ronde, or where Jerry, they expressed some desire to have additional information and dialogue around the concerns. So for the board to make informed decisions, we had a vote to move forward to study the impact that changing in the structure of the road commission would have. Certainly, we have committed and serving road commissioners that would like to maintain their appointments, and I understand that. But we've also had dialogue around potentially a need to raise taxes on residents of the county to meet infrastructure needs. And we know we have shrinking revenue related to fuel efficiency and reductions in gas tax. That's the primary funding mechanism for infrastructure. We've had other counties nearby in our region evaluate efficiencies, and they articulated they saved substantial resources doing that. So, you know, this will likely need to occur at some point, or may need to occur. We should make an informed decision. I do not know all of the impacts that weighing in of them as an internal department would have. And that's why a study of that impact would be a valuable exercise. If it can save, you know, significant resources to address concerns, and potentially we have a way to impact some of the other both policy and fee structures involved that I've learned and tried to articulate to this body, that can be a valuable exercise for us to make informed decisions. So that's where I'm at. I would encourage this body to be thoughtful and meaningful and really look at ways we save money and we don't raise taxes, so we have roads. Thank you.
And we do have a communication from the road commission. It's in our 7 o'clock meeting. They've asked to meet with Vice Chair Ray, myself, and Vice Chair Pro Tem Hepler, and their chair and vice chair with Kevin and Joanna, I believe. That was, am I correct on that? Yep. Yep. Okay. So this board has no problem with leadership meeting with leadership of the road commission, I'm assuming, correct? So, okay, we will continue that meeting, but what is this board's thought on moving forward? Do you want to wait until we have that meeting with the leadership of the road commission? Or, I mean, Commissioner Hepler?
Thank you, Chair. Before we move on with the study, which is going to cost us a substantial amount of money, I would say let's hold off till after we have that meeting. I have heard from a number of my township residents, supervisors, et cetera. They don't want us to spend any more money. They need the money to fix the roads that, as Commissioner Stubbs has talked about, and changing the way that it's currently run. They're very good with it. In fact, they received a letter, I think that was sent to all the rest of them from Ross Township. They were very concerned that we leave things alone with the road commission. They're doing a good job. They just spent a whole lot of money from their taxpayer dollars to resurface most of their roads over the last 3 years. So they were very satisfied with what's going on. They realize not everything gets always answered in a timely manner, but they do recognize the importance of the work that the road commission is doing. So I would say let's definitely wait until after we have that meeting. Thank you.
Okay, let's wait and let's have a meeting with leadership. I'm sorry, Vice Chair Ray, I'm sorry.
Thank you. I just have a quick question for clarification. When you ask about thoughts on moving forward, we've already voted to do the study. So what exactly are you looking for?
We'd have to vote for payment of
To
the
see
study.
which one we're gonna go with?
To which one is recommendation would have to be on our claims list. I will let commissioners know. I'm not planning on voting for yes on that study, in that I don't think we have the infrastructure to do it at this time. I would really like us to focus on building up our infrastructure within administration, within finance, within everywhere else, so that we can start, kicking and taking names. But I see this commission and this ability. We're growing and we're getting better. I think that we can wait and see back the study if 9 people want to do, or if majority of commissioners want to do that. But again, we'll have to vote on moving forward to the study. It'll have to be an appropriations and a vote. Commissioner Morales.
Thank you, Chair. So I know you said that leadership was going to meet with road commission leadership. Since Jen she ignited the situation, is it okay? I mean, I didn't ask her, but I would think it'd be appropriate if she attended that
I
meeting.
think it would be far more productive if she did, because I would not be very good at advocating on her behalf without her there.
Thank you. Are you okay with that? Jen?
You want to take, you just trying to get out of it.
I can never take your place, Vice Chair, but I'm willing to attend.
Okay, so that's what we'll do. We will not have any vote on moving forward in the study until we have leadership meeting. Commissioner Mazer.
I just wanted to chime in. Yeah, I'm not in favor, well, I am in favor of waiting, until after your meeting. And I'd rather not spend the money. And personally, I'd like to leave it the way it is. So that's my feeling, but didn't need to get after your.
Okay, we'll put it on for hopefully 5 minutes and it won't be as long a discussion. It'll probably just be an up and down vote at our next commissioner meeting. And that way leadership can report back on, what was learned and what was said. Commissioner Gissler.
Did I understand you correctly, Chair? You're talking about having an up or down vote on whether we proceed any further at the 7 o'clock meeting tonight?
No, I'm talking at the 7 o'clock meeting in 2 weeks. And that also gives commissioners from the road commission an opportunity to address us. They're in Traverse City right now, getting an award, I believe, but they're in Traverse City. I don't want to make these types of, rash. I'd rather hear from them, hear from the people that, would like to dissolve the road commissioner, have it be in-house, and hear from the people that wouldn't. I think that waiting 2 weeks is appropriate and gives everybody a chance to get their ducks in a row, so as to speak, but I can't even talk either. I think it's contagious.
Quack, quack.
So I've lost my computer, so I feel I'm flying blind here. But okay, we can go. So we'll have an up or down vote in 2 weeks. Is that appropriate with all commissioners? Yes. Okay, next up, Commissioner Liaison Alternate Appointments Discussions. Is this a closed session item or is this okay? Before I get going, then, does somebody take us into closed session? I don't think I have it. Yeah, usually the.
Okay. I move that the board go into closed session as permitted by Michigan Open Meetings Act MCL 15.268(1)H to discuss material exempt from discussion or disclosure by state or federal statute, specifically to review a written legal opinion authored by Corporation Counsel dated April 17th, 2023.
Is there support? Motion and support. Clerk, will you please take roll? Shoot, question from Commissioner or Vice Chair Ray.
Thank you. So my question, the legal opinion is only in regards to one board. I'd like for us to open the discussion for more. Is it not just for one?
I can't discuss the content of the
Well,
legal opinion.
know,
I mean,
but
it's.
I also don't want to vote to go in there and then we're not having the entire discussion.
Can't discuss the content of the legal opinion in the open meeting.
I can say that as chair, I will allow discretion so that we can talk about the process more than individual. It'll be more process oriented.
Commissioner DeLu,
Yes.
Commissioner Gissler,
Yes.
Vice Chair Pro Tem Hepler. Commissioner Mazer,
Yes.
Commissioner Morales, Vice Chair Ray, Commissioner Strebs,
Yes.
Chair Taylor.
Yes.
Commissioner Wheeler.
Yes.
9 yes.
I'll make that motion to come back into closed session.
Aye.
Is there a motion to approve the minutes of closed session?
I'll make the motion to approve the minutes of closed session.
The motion to approve the minutes was made by Commissioner Wheeler, supported by Commissioner Hepler. All those in favor say aye.
Aye.
Motion carries. We are adjourned until the 7 o'clock.
Well, I just saw.
Oh, really? That's good. Oh, gosh. I think we got to pass it or take them both off so that we can do them one after the other. But I'm going to call the Kalamazoo County Government Board of Commissioners, April 18th, 2023 regular meeting to order. Giving tonight's invocation, Commissioner Gissler.
Father, as we gather today to make decisions for our community, bless us that we may use our best skills and judgment. Guide us as we consider the merits and pitfalls of each matter that come before us. Grant us the wisdom to act in the best interest of our community and fellow citizens. Help us show respect for each other and our entire community. Please grant us the wisdom to govern amid the conflicting interests of issues of our time. Finally, watch over the women and men who keep us safe at home and abroad. Amen.
Amen. I pledge allegiance to the flag of the United States. All right. Clerk Cox, will you please take roll?
Commissioner DeLu,
Here.
Commissioner Gissler,
Here.
Vice Chair Hepler, Commissioner Mazer. Here. Commissioner Morales. Vice Chair Ray. Commissioner Strebs.
Here.
Chair Taylor.
Here.
Commissioner Wheeler.
Here.
9 present.
All right. Next, we have the proclamations. Commissioner Strebs, do you want to read us through the proclamations?
Yes, thank you, Chair. Get our first. We have a. Get it open. It's thinking about it. There we go. Thank you. I have a proclamation to honor Philip Newman. Whereas Philip Newman has served the citizens of Kalamazoo County for 25 years as of April 6th, 23. Whereas Philip Newman has faithfully served as deputy. And whereas the County of Kalamazoo wishes to acknowledge and honor employees who have longevity under the umbrella of county government, since it's through longevity the expertise in the employee's particular field is achieved. Now therefore be it resolved that the Kalamazoo County Board of Commissioners does hereby acknowledge with gratitude the many years of dedication and service Philip Newman has imparted to the citizens of the county and offers its best wishes for many more years of mutual association. And move the adoption of that proclamation.
I don't think we support these, right? We don't support the proclamations, or can we support this one? Up, there's a motion and support. All right. All those in favor, or let's take roll call vote. Clerk Cox, sorry.
Commissioner DeLu.
Yeah.
Commissioner Gissler.
Yes.
Vice Chair Hepler.
Yes.
Commissioner Mazer.
Yes.
Commissioner Morales. Vice Chair Ray. Commissioner Strebs.
Yes.
Chair Taylor.
Yes.
Commissioner Wheeler.
Yes.
9 yes.
Thank you very much. Is Philip in attendance tonight? I forgot to ask before the meeting. No? Okay, well, thank you very much for your service. The proclamation recognizing April 2023 as Kalamazoo, Commissioner Wheeler.
I move the approval for a proclamation recognizing April 2023 as Kalamazoo Valley Community College Month.
There is a motion and support. Clerk Cox, would you take roll again, please?
Commissioner Gissler.
Yes.
Vice Chair Hepler. Commissioner Mazer.
Yes.
Commissioner Morales. Vice Chair Ray. Commissioner Strebs.
Yes.
Chair Taylor.
Yes.
Commissioner Wheeler.
Yes.
Commissioner DeLu.
Yes.
9 yes.
Thank you very much. Commissioner DeLu, will you take us through communications? And I think Commissioner Gissler has something to add. Commissioner Gissler, why don't you go ahead and do it, Commissioner Gissler, sorry.
I'll be happy to. Under communications, item 5 on the agenda. They're all 2023, and so I won't read that to each one of these. We have a letter 6016 from Brady Township indicating they do not support the county having direct oversight of the road commission. Item 6017, a letter from the road commission requesting a meeting with the county board leadership and Administrator Catlin. Item 6028, a voicemail from Keith Marati, and I apologize if I butchered that, opposed to the abortion funding proposed by the YWCA. Item 6029, a voicemail from Hope Marati, opposed to abortion funding proposed by the YWCA. And item 6030, a voicemail from John Burhans, opposed to the abortion funding proposed by the YWCA.
Thank you. Any other communications from commissioners? Commissioner Gissler?
Yes, I have one. It's a letter, a one-page letter from all 15 township supervisors indicating that they don't approve at all of trying to move the township or the road commission supervision and organization into the county. And they don't want to see any more money spent than already has been funding consulting studies.
Thank you. Just give that letter to probably Clerk Cox, I think would be in, or yeah, so she has a copy of it. Commissioner Strebbs.
Thank you. Just to clarify, that's not a letter from all 15 supervisors of the townships. Thank you.
Okay. Moving, the chair will entertain a motion to approve the April 4th, 2023 draft committee of the whole and regular meeting minutes, as well as the April 6th, 2023 draft special meeting minutes. Moved by Commissioner Hepler, supported by Commissioner Strebbs. Okay, discussion. Clerk Cox, would you please take roll?
Vice Chair Hepler.
Yes.
Commissioner Mazer.
Yes.
Commissioner Morales. Vice Chair Bray. Commissioner Strebbs.
Yes.
Chair Taylor.
Yes.
Commissioner Wheeler.
Yes.
Commissioner DeLu.
Yes.
Commissioner Gissler.
Yes.
9 yes.
All right, that takes us into the approval of the agenda. I am going to pull item 2023-5919 and 2023-5920 from equalization. I'd like to just talk about that. I intend to vote for it enthusiastically, but I think all commissioners, I'd like to just, highlight are the growth in the county. So any other changes from the agenda? Commissioner Ray.
Thank you. Under housing, I'd like to pull 2023-5934 and 2023-5939.
Could you please repeat that?
Okay.
Okay.
Next up on our agenda is public comment. This is an opportunity for citizens to address the Board of Commissioners. Please give us your name and address, and you have up to 3 minutes. Thank you. I'm sorry, Matt. Okay, is there a motion to approve the agenda as amended? It's made. Support by Commissioner Ray. All those in favor, say aye. Those opposed? Okay, now we can do the citizens' time. Thank you.
Good evening, commissioners. I will apologize ahead of time for what I'm getting ready to say, as I did last night at the city commission meeting. I am late, more than late, above late. I don't know how to say it, but NACD is having a groundbreaking on 2 of the homes on Ransom, and you guys approved $311,000 for one of them. We are still waiting for the state and the federal, but we did not want to take a chance on losing a really good contractor, in that they were like, if we don't, move forward, they would take another job, and then we may not get the houses. So we agreed, we have signed a contract with Garland Construction. And it's Saturday at 11. So if any of you can be there, we welcome you. We will tell you that when we do the second of the 4, that we will do this again, and we will promise to give more time. But we just want to thank you guys for hanging in there with us. You know, last year, the bids came in at over 580,000. One of them was 602 for a home. And we're trying to make these affordable. We will, due to the grant dollars, one person at 30%, which will come from your funds, 2 people at 60%, and then 1 at 80. And even with the cost still being 413,000 for the homes, the grant dollars will allow us to do 20-year, what we call recoverable grants. So as they stay in, they won't have to finance that gap because of the grant dollars. But if they don't live there, if they try to bring someone else in, we will have a first right of refusal, because these are forever homes and they were meant as an anti-gentrification strategy to increase home ownership in the North Side neighborhood. So the documents will be for that. So again, if you can come, we appreciate it. And we will be better in inviting you sooner. So thank you so much.
Thank you. What was the address of that, 11 a.m. on Saturday?
So we're going to give you 440 West Ransom. So it's behind the public safety station, but there's nothing there. There's 4 vacant lots. And so, and if anyone wants to park at NACD and walk Ransom, then they can, but the address is there. It's the 440 and 444. So 2 of them will be started.
Thank you very much. Are there any other citizens wishing to address the board?
Michael Fry, 13463 South 44th Street, Fulton, Michigan, 49052. Good evening. My name is Mike Fry, and I'm the chair of the Kalamazoo County Veterans Affairs Committee. I also serve as the campaign co-chair and treasurer for the ballot questionnaire committee, Yes for Kalamazoo Veterans. Members from both of these veteran-led committees, along with employees from our Veteran Service Office, are behind me this evening. We are here to support the veteran millage resolution that is included in the consent agenda for tonight's meeting. We are requesting that the Kalamazoo County Board of Commissioners approve this resolution so that we can ask voters on November 7th to levy 0.10 mills that will properly fund our Veteran Service Office, as it provides dedicated programs and services for local veterans and their families. This will cost the average property owner that resides in Kalamazoo County approximately $10 per year. In turn, the veteran millage will help generate approximately $1 million every year for the next 10 years to help serve the veterans in our community. I had the honor and the privilege to deploy with Marine Special Operations Command during my time in the service. MARSOC has a creed that I would like to partially share with you this evening. The Marine Raider Creed speaks of spiritus invictus, an unconquerable spirit. The creed goes on to state, I will always go a little farther and carry more than my share. We are asking this body to go a little farther tonight by approving the resolution to place the veteran millage on the November 7th ballot and leave it to the people to decide. We will then spend the next 7 months asking the residents of Kalamazoo County to carry more than their share by approving the veteran millage to help take care of our local veterans and their families. Some of the greatest Marines I ever had the privilege to serve with in Iraq and Afghanistan instilled in me that Marines don't fight for glory, they fight for their fellow Marines. And I've tried to the best of my ability to continue to live by that ethos, even though I no longer wear the uniform. And I know that many of the men and women that are here tonight standing behind me live by that very same ethos. And I'm asking that we all fight, not for the glory, but for the veterans that live in our community, to do the right thing. Democrats and Republicans, progressives and conservatives, put aside our differences and come together to help our county government serve those who raised their right hand, took an oath, and walked away from their families, friends, schooling, and careers to serve their country, to serve our country. Thank you very much for your time.
Thank you. Are there any other citizens wishing to address the board? Administrator Catlin, would you advise anybody online or pre-recorded?
Thank you, Chair. If you indulge me, I did receive Village Manager Lutz's cell phone number. I could bring her on my cell phone and project it if that's okay.
Let's make this work.
Okay, one moment, please. Well, I tried. Chair. So, Dina, may you advise on any hands that are raised on Zoom, please?
There are no hands raised.
Any pre-recorded?
No pre-recorded calls this evening. Thank you.
All right. Well, that moves us into the consent agenda. And Commissioner Gissler, you have nicely promised to take us through the consent agenda this time. I won't ask you again for a couple months, I promise.
It was my pleasure, and hopefully I'll do an okay job. Again, everything starts out 2023, so I won't read that portion of each item. The first one is a recommendation for approval of transfers and disbursements, accounts payable and payroll disbursements. Excuse me. Under administration, item 5957, request for provisional approval of fiscal year 2024 Michigan Indigent Defense Commission Compliance Plan. Under Board of Commissioners, item 5850, review and approval of local WIOA plan modification. Item 5954, request for approval to appoint Gary Sigmund to the Kalamazoo County Transportation Authority. Item 5965, request for approval to appoint Doreen Gardner to the Older Adult Services Advisory Council. Item 5966, request for approval to reappoint Tracy Lynn to the Environmental Health Advisory Council. Item 5986, request for approval of a resolution authorizing millage election for the County Veterans Services Program. Item 6012, request for approval of an ARPA advance payment request from J&J Property Investing DBA doing business as Urban Exposure. Item 5854, request for the approval of project agreement with Western Michigan University Kircher Center. Item 5860, request for approval of project agreement with Western Michigan University Kircher Center. Sounds similar. Item 5864, request for approval of project agreement with Western Michigan University Kircher Center. We're in a rut here. Under diversity, equity, and inclusion, item 5594, request for approval of the DEI Community Advisory Committee bylaws as presented. Under the Drain Commissioner, item 5935, request for approval of Sunset Lake resolution. Under Finance, item 5938, request for approval of various budget adjustments and transfers. Under Health and Community Services, 5931, request for approval of an extension of a temporary employee request. Item 5994, request for approval of a budget transfer from the Area Agency on Aging to the 3A's senior millage budget. Okay. We're eliminating that one. 5939 under housing, request for approval and signature of a grant extension with building blocks.
I think 5994. That was all. Yes, we're down to information technology.
Oh, you wanted both of those go on from housing? I only took the first one, sorry. Information technology. 5928, request for approval and signature for Cisco Security Enterprise Agreement. Parks and Expo Center, 5923, request for approval and signature of Willem Preserve amended and restated agreement. Under Planning, 5883, request for approval of a budget transfer to the Planning and Development Department for conference registrations. Under the Sheriff, under the Sheriff, 5870, request for approval and signature on school resource deputy agreement between Gull Lake Schools and Kalamazoo County Sheriff's Office. Item 5871, request for approval and signature of a one-year extension of the police protection agreement with the city of Galesburg. That does it. So I propose that, I move, don't propose, that the consent agenda as read with the items not read being deleted be voted on at one time on a roll call vote and considered as a consent agenda by the county board.
Motion made and supported by Commissioner Wheeler. Discussion? Actually, there's no discussion on consent agenda. So Clerk Cox, will you take roll, please?
Commissioner Mazer.
Yes.
Commissioner Morales.
Yes.
Vice Chair Ray.
Yes.
Commissioner Stebbs.
Yes.
Chair Taylor.
Yes.
Commissioner Wheeler.
Yes.
Commissioner DeLu.
Yes.
Commissioner Gisler.
Yes.
Vice Chair Hepler.
Yes.
9 yes.
Right, motion passes. Commissioner Hepler, will you take us through take us into 5919 and equalization?
Thank you, Chair. Yes. 235919, request for approval to accept the 23 Kalamazoo County Equalization Report that the board of accepted the 2023 Kalamazoo Equalization Report as outlined in the packet.
Is there support? Supported by Commissioner Wheeler. Okay, the reason I pulled this from consent agenda, just this is history shattering. I went back about 10, 12 years through equalization reports, and I couldn't find one as good as this one. 6.8%, correct? Taxable value growth, Kevin? 6.8% taxable value growth in all of our jurisdictions. That is huge. That's like Ottawa County type numbers. And I think that we are, it's just a testament to the community that we live in. I mean, I could say that, hey, the county commission did that. No, it's everything that's happened with, our large economic engines, Pfizer, Stryker, the growth that's happening in this county, the home builders that are building bigger and better and nicer houses. Our real estate value in Kalamazoo County is going through the roof. That's great news. That means that we're going to receive more tax dollars as we collect our property taxes. But we also got to make sure that we know that there's a lot of people in our community that can't afford housing. So as we celebrate this growth, I think we also need to be cognizant of, as we are getting higher and higher and higher price homes in this county and higher price land in this county, we need to be cognizant and mindful of those that are less fortunate as well. So I just wanted to put that out there. But I think this is huge news, 6.8% growth. Thank you, Matt. I know he just runs the numbers, but I think this is just absolute tremendous news for Kalamazoo County. Any commissioner comments or questions? Commissioner Hepler.
Thank you, Chair. Last week I attended a meeting at Southwest Michigan First Had, and they brought forth a lot of the information which you just kind of elaborated on, and the fine work that they're doing in trying to attract new businesses and job growth, as well as retaining that of underserved and those folks that need the help that you just articulated, probably much better than I can. But it was very nice to be at that meeting and see all the folks that are at the table, and they're trying to work with all the counties and all of the communities in creating good growth and job creation for our community and making this place a great place to live, work, and play. Thank you.
Thank you. I think with that, we will, I think I can take a roll call vote on this, correct? Yep. Okay. All those in favor signify by saying aye. Those opposed? Motion carries. Do you want to do the 5922, Commissioner Hepler? So you got it right there. I think now that we accepted it, now we have to adopt it.
Uh, 235920, request for approval of a resolution to adopt the 2023 Kalamazoo County Equalization Report, that the board approved resolution to adopt the 23 Kalamazoo County Equalization Report as outlined in the packet.
The motion is supported by Commissioner Strebs. Any discussion? All those in favor signify by saying aye. Opposed? The motion carries. Okay, now we get to housing. Commissioner Morales, do you got it up? No? Okay. Commissioner Hepler, you got it? Go for it.
All right, thank you, Chair. 235934, request for approval and the signature of a grant extension with the Kalamazoo County Land Bank Authority.
No, that's enough. There's a motion and support. Discussion. Commissioner Vice Chair Strebs, or I'm sorry, Vice Chair Ray.
Thank you, Chair. So I pulled this one because this is 2022 millage funding, and it hasn't been spent down. I guess I just have questions as to why it hasn't been used. Is there a need with the issues with housing throughout the county? Is it best allocated somewhere else if there isn't a need? Just why are we looking to extend this? And the money hasn't been touched.
Chair, may I?
Yeah,
Vice
please.
Chair, if you wouldn't mind, I can have our, oh, there you are. I was like, yeah, anyway, I can have Housing Director Balkema speak to that.
Good evening, Honorable Chair, Vice Chair, Board of Commissioners. Sid Ellis, the Land Bank Director, is in the audience, and instead of speaking for him, if it's your pleasure, I will call him up so he can answer the Vice Chair's question directly.
I think he probably would be able to give a better answer. So yeah, if he's okay to do it.
Commissioner Sidney Ellis, Executive Director of the Kalamazoo County Land Bank. When that grant was granted, we had 2 employees, well, we had 3.5 employees. During that time, 2 employees resigned, and we are hiring 2 more employees to replace them. And that is why we asked for the extension.
Okay. Do you have a follow-up, Commissioner?
When were these funds awarded, Director Bachman? Was it early 22?
Yeah, June.
Okay. Thank you.
Okay, any other commissioner comments? Okay, Clerk Cox, will you take roll, please?
Commissioner Morales. Vice Chair Ray. Commissioner Strebs.
Yes.
Chair Taylor.
Yes.
Commissioner Wheeler.
Yes.
Commissioner DeLu.
Yes.
Commissioner Gisler.
Yes.
Vice Chair Hepler.
Yes.
Commissioner Mazer.
Yes.
9 yes.
That takes us into our second housing. You're on a roll, Kepler.
Thank you, Chair. Not a problem. 235939, request for approval and signature of a grant extension with the building blocks of Kalamazoo, that the appropriate county officials be authorized and directed to execute a grant extension with the building blocks of Kalamazoo through December 31st, 2023.
There is a motion on the floor. There is a support from Commissioner Wheeler. I beat you to it by a half second. Okay, discussion. Vice Chair Ray.
Thank you. So I'll put this on with the same questions, but understanding that building blocks is just seasonal, it's kind of understandable if the funding didn't go out until last June. So it makes more sense than, and the allocation is a lot smaller than that of the land bank. So I guess I don't really have questions about this, and I'm happy to support extending the grant.
Thank you. I think with that, then we could probably do a voice vote. All those in favor signify by saying aye. Those opposed? Motion carries. Right, that takes us into unfinished business and general orders. The chair knows of none. Is there any unfinished business? That takes us into new business, non-consent. The chair knows of none. Any new business? All right, this takes us into public comment. This is an opportunity for citizens to address the Board of Commissioners. You give us your name and address, and you have up to 3 minutes. All right, Administrator Catlin, is there anybody hand raised, or has you gotten a call from the Schoolcraft manager?
Thank you, Chair. I have not. I actually tried to reach out in between our time here and have not heard back from them. So I guess we'll hear from them at the next meeting. Dina, may you please advise any hands that are raised in Zoom, please?
There are no hands raised.
Okay, that takes us into reports of officers, bodies, administrator, controller. Chairperson's report. I am really, really happy about that equalization report. I mean, we're just getting started with our budget process for 2024. And going into that, I think it puts us in a much stronger position as we talk to our department heads and we talk to our employees about what's possible. I think we have a lot more possible with that equalization report. It gives us a lot of flexibility. $48 million is what we roughly get in taxes every single year, just with property taxes alone. That's not counting anything else, but that's a huge portion of our revenue. And to have a growth at that level, I think is just, it's a testament to the hard work of not just ourselves, but every other governmental entity and every other private sector group in this county that's trying to make this place a better place to live, work, and play, as Jeff always says. But I'm really excited about that. I'm excited about the future and potential in Kalamazoo County. And I think we are moving in the right direction. So I'm happy to be here, but Vice Chair.
I don't have a report, but I will say, since we're on the excitement, the National Health and Nutrition Examination Survey, that information was extremely exciting to me. I'm going to be reaching out with some questions, but I'm excited that our community was selected to participate. And I don't have anything else. Thank you.
Vice Chair Pro Tem.
Thank you, Chair. As I mentioned a little bit earlier, Southwest Michigan had a nice informational meeting with a number of community businesses and governmental entities, and a good report on their work to make Kalamazoo a great place to work, live, work, and play. I want to reach out once again, as I usually do, and thank all of our military folks and our fire, police, and ambulance folks that are out there, our hospital folks that are working tirelessly to keep us all safe. I want to remind our citizens that we're coming into spring, as we kind of got a good taste of it last week. Fall weather can happen at any time. We've had some of it already. So please be safe. Don't take chances you don't need to. So be out there, be safe, and look forward to working with the community and serving as we have been. Thank you.
Commissioner Morales.
Thank you, Chair. This is like the quickest meeting in history. I like it. So nothing big, but I did want to congratulate Kalamazoo Valley Community College on their proclamation. I'm in 12 years in at the college. It's a privilege and honor to work with folks who love serving our community and really making big differences so that economically, hopefully, we'll see a difference as people graduate from the trades and different degrees. I also wanted to shout out the best sorority in the entire universe, Delta Sigma Theta Sorority Incorporated, celebrating 50 years with their alumni chapter. They have an exhibition again at the illustrious Kalamazoo Valley Community College this Sunday. You see that plug in there? I hope to see everybody there. This Sunday, April 23rd from 1 to 3 p.m. If you don't know about Delta, just Google them. We're in everything from government to all things humanity to all things service and scholarship. So that's all I have for tonight. Thank you.
Commissioner Straps.
Thank you, Chair, and Commissioner Morales be celebrating with her sorors over as much as possible. I love it. Just in the community, we've had a lot of communication around a large spike in opioid overdoses and deaths recently. It looks like that has slowed, hopefully, over this last day. But just to be mindful, we have got allocations as a board that we will be making about how to tackle the opioid epidemic ravaging our community. Grateful for our partners like Hope Through Navigation and the COPE Network that are out on the ground, getting Narcan out into the hands of people who need it, and reminding folks to think about harm reduction, people that use to seek treatment. If you can't seek treatment, then seek support. You don't use alone. Make sure that you call 911 if you are with someone you suspect of overdosing. And let's save some lives that way. Thank you.
Commissioner Wheeler.
I do not have anything. Thank you.
Commissioner DeLu.
I want to somewhat echo what Commissioner Morales had to say about Valley. It's a wonderful institution. I began my 16-year college career at Valley. It only took me 4 years to get through the 2-year school. But I'd like to tell the younger people all their student debt. When I took my first class there in 1973, it was $10 a credit hour. Of course, I was making $2.50 an hour at a shoe store, but no, I had a great experience there, and it's a wonderful educational institution, and Kalamazoo should be proud of it. So, thank you.
Commissioner Gissler.
Thank you, Chair. I want to pay a special kudo to our corporate attorney, Angelina Barnes. Place hasn't been this good attorney-wise, and that's no slam at Cole Stoker Toski. But, it's great to see you in the chair on a regular basis, and you're doing a wonderful job for us. You managed to keep today's closed session to a minimum, and I appreciate that. And because you've bestowed on me your main motion, you'll be seeing this periodically. I'm a sucker for fuzzies. Thank you.
Commissioner Mazer. Okay, just before we end, $2.50 an hour, $10 a credit hour. Up. Administrator Catlin, I am so sorry. I did this twice in a row. I'm sorry, Administrator.
That's okay, Chair.
We were saving the best for last, and that's why
I love it. Thank you, Chair, Vice Chairs, Commissioners, audience. First, I would like to start off by saying, just giving a huge thanks to all staff in the county. As you know, a lot of work goes into preparing for not only these meetings, but just keeping county government running. And I know that we convene twice a month, and some of us more often than that, but there's a lot of work that goes into what we do, and staff is short in some areas, but we get the job done. And I just want to just share my appreciation with staff. I just have a few items just to go over really quick, some announcements, and then I'll let everyone enjoy the sunshine still. So we have Justice Center tour scheduled for the Board of Commissioners May 5th at 4 p.m. And so we'll send that out via email with the calendar invite. So that way you can see all the nice progress that's going on in the building. We have received some media inquiries, and we'll set something else up for the media kind of later on, but the media will be able to go through as well separately. Vicksburg Village Hall, they're doing a groundbreaking on their new Village Hall that they're going to construct. So that'll be April 24th at 4 p.m. So I wanted to share that with you. And then I wanted to circle back, and we'll still send some information about this, but we're still for the question on the Siegel evaluator and what the cost is associated with evaluating position-specific positions. What we will do with that, there's actually a contract that's in process of review right now. So we'll have those numbers shortly, and so we'll be able to share those. The chair did speak to the budget process. We actually kicked that off last Friday internally. And so the board will begin being engaged in that process very, very shortly. So we'll have some information on that and the establishment of the CIP committee for review of capital improvement items. And that's all I have this evening. Again, thank you for a great meeting tonight. I think that we've accomplished a lot, and I think with the team in place now, I think we're starting to make some really good progress. So it's looking great. Thank you.
Thank you. Yes, Commissioner Krebs.
Thank you so much, Chair. Administrator Catlin, I just wanted to circle back around to you quickly. We had some discussion at our last meeting about the RMS system for the sheriffs and a collaboration. There is a desire for some collaboration and the buy-in on that system across our municipal law enforcement agencies. And we recently had a discussion also around data collaboration with the Upjohn Institute. And the city of Kalamazoo expressed some urgency about the end life of their data system. And so I just wanted to elevate that back to you again and see do you have some recommended next steps? We need to elevate a concrete discussion on that to save costs there.
Yes, thank you, Commissioner Krebs, for the reminder. So we were going to discuss that with board leadership. I believe it's next Monday when we have our agenda review session, but however, it should hopefully be placed on the May 3rd agenda for discussion. Yep.
And that was my intention as well. I've been kind of waiting for the information, especially as it relates to our ability to get out of the current system and what the shelf life was for the city of Kalamazoo as well. But yeah, that is on my priority list. Okay, and then before we adjourn, $2.50 an hour, $10 credit hour. At $3.60 now, you'd have to be making $90 an hour at the shoe store. With that, we are adjourned.